There are three major complications that can occur from taking alcohol. Three major acute or sudden complications that can arise while an individual is taking alcohol. The excess of delivery because of the issue of dirty December. So in as much as you're doing dirty December, please don't do yourself dirty. Number one issue, number one acute or sudden issue problem that you can have while taking alcohol, number one is what is called stroke. When I was in school some time ago, around that kind 2018, 2019, a young man about 38 to 40 years old was brought to accident and emergency, and he had stroke early hours of the morning because he was taking alcohol with his friends. He didn't know that he had hypertension, and from there he had sudden elevation in blood pressure, and then from there developed acute intracerebral bleeding. He bled inside of the brain, and that is how he was brought to AIA while we were in school. And by the time they did CT scan, they found out that there was blood inside of the brain. Of course, you guess what happened? The man died in the process. So in as much as you want to go and do your dirty December, remember that there is no known health benefit of alcohol. Recently, there is no known health benefit of alcohol, and there is no amount of alcohol that is good for the body, be it small, be it large. There is no known amount of alcohol that is good for the body. So even if you take small amount, it may not be good for your body. So number one complication that can occur, number one problem that you can have while having alcohol, while taking alcohol, is stroke. Number two is heart problem. You can suddenly develop what is called cardiac arrhythmia. Now understand that if your heart is beating, before your heart will beat, there is something called electrical activity of the heart. That electrical activity will occur first before your heart can beat. But alcohol can cause that electrical activity that can occur not to occur normal, and it is called cardiac arrhythmia. So if the heart is not beating well, it may be because there is abnormal electrical activity of the heart that will cause the heart not to beat well, and alcohol can cause that arrhythmia of the heart. That can cause the heart to stop beating. That can also cause what you call myocardial infarction, because when the heart is not beating well, the blood vessel to the heart can be blocked, and that can cause that part of the heart to undergo what is called necrosis, that is infarction, and that heart will die. And if the heart dies, your guess is as good as mine. That's number two. Number three is what is called perforated PUD, perforation of the peptic ulcer. For some people that have ulcer, maybe small ulcer, or you may not know that you have ulcer, and then you take a little of alcohol or a large amount of alcohol while you're doing your dirty December, you can have perforation of the PUD, that is the ulcer. Like people that have ulcer or at risk of having ulcer, that ulcer can just break open, and when that occurs, you can see some people, you see them vomiting blood while eating or while taking alcohol or while eating anything. That can result in death. Do you understand? So while you are doing your dirty December, please ensure that you don't go and take an amount of alcohol that may affect your body. Be watchful of what you are taking around this time. Please, if you like the video, remember to follow us, be part of our community by liking, subscribing, and following us. Don't forget to share the video. If you have any question at all, you can ask your question and I'll answer you on this channel. Thank you so much.